Aloha and welcome to Kokua Council's Annual Community Forum for 2020. I'm Lila Mower, the president of Kokua Council. We have a panel of guests and participants who will be presenting to us their legislative priorities for the year 2021. 2020 has been a very unusual and difficult year. And when we had our legislative wrap up a few weeks ago, we called it the good, bad, and ugly. We heard mostly ugly news. And the biggest problem I think we're all going to be facing is a lack of appropriations, a lack of funding. I don't want to delve into that too much, but I do want everyone to keep that in mind as we do our presentations. Now, as we do our presentations, I'm going to ask you to rate every presentation, because at the end of this meeting, I'm going to ask you to all send to an email address, kokuacouncil.programs@gmail.com, what you think your first 5 priorities are in the presentations, which proposals, which initiatives you think warrant our attention. We have as a guest Senator Carl Rhodes, and I asked Senator Rhodes to maybe give a little bit of an introduction and tell us what you see for 2021, if you will, please, Senator Rhodes. Thank you.
Thank you. Thanks for having me. I will be brief. Unfortunately, I think my colleagues on the 7th were spot on accurate. There are a couple of slivers of hope. You know, if a vaccine is developed, and even if it's only starting in the rollout phase in the early months of 2021, I think that's a game changer, and this economic situation will improve after that. The other thing that could change is if I don't know if it really matters in this respect who wins, but I think if Biden wins, we're very likely to get some kind of a state municipality CARES Act that will help tremendously with our budget problems. If Trump is reelected, I don't think it's impossible that would happen, but of course he's already had the opportunity to do that, and so far nothing's happened. So I think those are both reasonable bases for rational hope, but yeah, you know, in the next few months at the state level anyway, things look very, very bad. I haven't been to a Kokua Council meeting in a long time, and my apologies. And just so you don't think it's because it's a political year, I was up for election this year, but I already won. I did not have a general election primary, so I'm attending just because I want to hear what's going on and what you guys had to say. So thanks for having me, and nice to see you all.
Thank you, Senator. May I ask a question?
Sure.
Tanya Machika wrote, Tanya Machika from the Tax Foundation.
Yes.
He wrote today that the governor's talking about furloughing employees for 2 days a month for 4 years to shave roughly 10% off of state payroll costs. And he said, Tom said the governor is also asking executive departments to come up with another 20% in cost reductions. When we did our legislative wrap up, Senator Kouchi and other senators and representatives had talked about tax cuts. And one thing struck me is that they were talking about maybe the necessity of a 10% tax cut right across the board. They also mentioned
a tax cut or a tax increase.
I'm sorry, a budget. Yeah.
Okay.
I'm sorry, wrong term. And then they also said that it may be not only a difficult 1 year ahead, but they were projecting as many as 4 years ahead. I don't know what the Senate or what the House has discussed since then, but are you hearing that too?
Well, the numbers are very dire. So all that stuff, I think, is unfortunately well within the realm of possibility. I think what's more likely is a tax increase on higher income earners. I mean, like quite high, not like above 75,000 a year, but more like above 400,000 a year. But I think it's a bad enough situation, or it will be in a few months, that all possibilities are on the table.
I see. All right. Well, thank you very much.
Thank you.
We have roughly 12 organizations making presentations of what they consider their legislative priorities for 2021. The first organization, Hawaii Intergenerational Network, is represented by Chuck Larson. Chuck, would you like to start your presentation, please?
Sure, thanks. Sometimes my voice is a little funny, and this is one of those times, but I'm not sick. I'm the president of the Hawaii Intergenerational Network. It's a nonprofit organization started in 1995. And for the first dozen years or so, we did a lot of projects with the Department of Education, basically bringing older adults into public schools for the benefit of both the older adults the public school students. Projects. Hello?
No, your screen froze for a moment. Go on, please, Chuck.
Okay. Well, 2 years ago, I was at a meeting where I met with the foundation director for the HMSA. And I know for years she and I had been talking about doing a shared housing project. And at that time, she told me that I should go ahead and use the existing Hawaii Intergenerational Network board. We just call that HIN, H-I-N. It's kind of a mouthful to say that all the time. So we organized the board and we began this project with some funding from the HMSA Foundation. Basically, we bring people together, people who own their own homes and who have a room to rent and are living by themselves, basically in isolation, with somebody who needs an affordable place to live. That sounds like a really easy concept, makes a lot of sense. In fact, we probably all know of somebody, we have history of people living together as long as we can remember. A little while ago, I had a friend of mine, he was a PhD student at Chaminade, and he and I were volunteering at a
Oh, I think we're having technical difficulty. Chuck, I don't know if you can hear us, but you're a little frozen. You're frozen.
Should I continue?
Yes, please do. You might freeze up again, but let's keep on going. Oh. I don't know what happened to Chuck, and I'm looking for him on the screen.
Yeah, I see him there. He's now muted.
Oh, he's muted. Okay.
I worked with Chuck with HIN Intergeneration, and one of the big things that they did with Senator Chanoklin was help coordinate Youth Day, and they entered a interdenominational where where the children and the adults come together, like at your parks or Department of Recreation, all the different ones fell under that category. He's really involved in a lot with the intergenerations working together. And probably a lot of you know of the Siegel School, how they are not intertwined the children, the daycare, with the senior care, and the success that they have with these programs, because the little children, they love the older seniors. They're not afraid of them. And Chuck has worked in Hawaii Intergenerational Networking for many years and is highly regarded in a lot of endeavors.
Yeah, I think Chuck's available. Go ahead. Yes.
You can hear me all right? Okay, great. Hey, thanks, Helen. You still driving a Jaguar?
Yes, we have one still. That's right. Thank you.
Okay, well, let me start over again. I don't know how much of what I was saying was not being transmitted, but the Hawaii Intergenerational Network started in 1995, and we did numerous projects with the Department of Education and other state programs. 2 years ago, we got a grant from the HMSA Foundation to help us start what we call a home sharing project. This is a project I learned about maybe 20 years ago when I was attending a conference on the mainland. And I always thought it was a good idea to do in Hawaii. We had a feasibility study, and basically all we needed to do was to make sure that we had an aging population. And of course, Hawaii's aging population is growing all the time. And also, we have to be in an area where there's high housing costs. And of course, that's us. So with our board of directors, we started, we hired some consultants with the grant money we got from HMSA and the Kaiser Foundation and from the Atherton Family Foundation. They're our support for this year. And we are developing a speakers bureau. We go out, we try and recruit people who can make referrals of people who are living by themselves in isolation, who would be willing to rent out a room to somebody who needs an affordable place to live. It sounds like a real no-brainer and something real easy to do, but it's actually very labor intensive. Most people who are living alone in their own homes tend to be females whose husbands have passed away and they're living in the home by themselves, and the house is kind of running down because they're afraid to get a contractor who may be swindling them or a roommate who may abuse them. So there's a lot of factors that make this difficult. Basically what we do is we're developing an inventory of people who are on the homeowner list, and we're finding people who need a place to an affordable rental. And through an application similar to what you would do on a dating application, we try and we bring them together. And we do criminal history background checks, financial checks, and we get people who personal references. And then we even have a trial period. We call it a camping period, where the home renter goes and stays a period of time with the homeowner. Now, and it may sound like a simple thing, but we're part of a national organization called the National Shared Housing Resource Center. And we're basically not having to invent anything. They've been doing this program in currently it's operating in 37 cities on the mainland. And some of the programs have been going for as long as 40 years. So they're a great resource to us. They've held our hands and given us all the information we need to make this work. Also, they've been very cautionary to having us have high expectations. So I say this is a very difficult process. They estimate if we had 100 people who own their own homes and were looking for a housemate, and we had 100 people who wanted an affordable place to live, that we'd only be making about 20 partnerships. So that's kind of an example of how difficult it is. And I think everybody's been reading information in periodicals and the newspaper about the dangers of living in isolation. Vivek Murthy, the Surgeon General under Barack Obama, said that living in isolation was worse than cardiac disease, diabetes, and obesity all combined. HMSA, what's the national organization, AARP, they estimated that living in isolation is the same hazard as somebody smoking 15 cigarettes a day. So this has become a real health issue too, not just a housing issue. And what I would like to do is everybody who's involved in this conference presentation, this Zoom presentation, be aware of what services we offer. If you know somebody living alone who would be better off with a housemate, or if you know of somebody who's needing an affordable place to live, please have them give us a call. We have a website, Home Sharing Hawaii, and we have information we can send out them, and we can help them get started on this process to find a roommate or find an affordable place to live.
All right.
Okay, that's probably good for me. Thank you.
Yes, thank you very much, Chuck. All right. Next, we have Jackie Gardner from, Jackie, I think you're from the Big Island, right? Long-Term Care Ombudsman. Did I lose Jackie? Let me see.
Just needs to unmute.
I see her on the phone, but she's muted. There we go.
Okay,
It says I'm unmuted. Am I unmuted?
yes, you are.
Okay. So yes, my name is Jackie. I am a contracted long-term care ombudsman for the east side of Hawaii Island. And I'm filling in for my boss who does this much better than I do. His name is John McDermott. He is the real long-term care ombudsman, and he is on Oahu. So our request, apparently a year or so ago, we came pretty close to getting some of the legislature money. 2 years ago, we got a grant from, I'm sorry to say, I have no idea where. I believe it was the legislature to fund 2 part-time contracted positions, one of which is mine and one of which is on Maui for 2 years, which will be coming up in another year. So ombudsmen go to long-term care facilities, whether they're nursing homes, something called an ARCH, an adult residential care home, versus a foster, which is a family foster care home. They all have different levels of care. What we do is we go in and speak with the residents regarding their rights and their care, and if they have any kind of issues that they would like to have help with. We are not surveyors. We don't come from the state. We don't make sure that rules are being followed. However, we do kind of make sure that residents' rights are being followed and those kind of rules. But it's not an inspection where they get dinged for being naughty, as it were. It's more like if your family member is in a nursing home or a care home and they want to get out of bed in the afternoon instead of in the morning, and they have asked and never gotten anywhere with that, then as an ombudsman, I could go in and try and do some form of like investigation, mediation, talk to staff, talk to grandma, see what's going on, and see if we can't come to a happy medium. None of that can be done without the resident's permission. So if the resident is worried about making problems, then if they don't give me permission, there's not much I can do to try and help. But usually they'll say, no, it's okay. What we are asking for is, since we only have one long-term care ombudsman on Oahu, which is John, and there are 12,000, I'm opening my phone and looking because I just had to text the secretary lady. There are 12,876 long-term care beds in the state of Hawaii and 1729 facilities, so 1,700 facilities. And as the long-term care ombudsman, John is expected to visit all those quarterly. We get the same funding as a little state like Delaware, who can jump in their car and go and visit facilities, whereas he has to jump on a plane, and nowadays with COVID, we all probably can imagine or know how much fun that's going to be. Take a couple of hours just to do the airplane, the check-in, the flight, rent a car, drive to who knows where to check on a house, and with one person and all of those residents, it actually, if you do the math, it ends up being 28 visits a day, which is pretty much physically impossible. So we're asking for one ombudsman position for Kauai, one full-time. We have a part-time, so to make the part-time a full-time for Maui. 2 for the Big Island, because Big Island is huge and geographically somewhat impossible. My district itself, for those of you that know some of the Big Island, I go from Honoka'a to South Point, and it takes me about an hour either direction just to get to the home. So the other day I went to Honoka'a and visited 6 houses and delivered masks. We're not technically supposed to be visiting residents, so I just went to the house, delivered a packet of surgical masks that I got, and kind of checked in and said, everybody okay. So 2 for the Big Island, which means take away my part-time and turn it into 2 full-time. And then 2 for Oahu, which is 1 extra besides John. And basically, that's my spiel in a nutshell. Any questions?
Thank you very much, Jackie. Well, we see that yours is going to be challenging because of the need for funds. Okay, next presentation is by, Samantha Trad, Compassion and Choices.
Aloha, thank you for having me. My name's Samantha Trad. I'm with Compassion and Choices. I am based in Southern California. I'm the Hawaii State Director and California State Director for Compassion and Choices. So I think I have a really wonderful job. But I want you all to know that we work really hard to make sure that everything we do is led by people on the ground there in Hawaii. We have a great team of folks in Hawaii. We have 2 people on the Big Island and then other contractors and consultants in Oahu. So just very quickly, I know I only have 5 minutes, but Compassion and Choices is probably most well known for helping to pass the Our Care, Our Choice Act, which I'm going to talk about in a second. But our goal is to help everyone chart their own end of life journey. So having the option, all end of life options available is what we're all about. So many of you may have heard about the Our Care, Our Choice Act. It took about 20 years to pass, as Senator Rhodes knows very well. He was a great champion for the Our Care, Our Choice Act. What it does is it allows a terminally ill person who has 6 months or less to live the ability to ask their doctor for a prescription for aid in dying medication to peacefully end their suffering. Now that sounds really simple, but it's actually a 12+ step process. A patient has to have 2 different doctors confirm their diagnosis and prognosis, and they have to have a mandatory mental health assessment to make sure that they're able to make medical decisions. So this means that it's not for someone who has advanced dementia. It's not something you put in your advanced healthcare directive. You have to advocate for it on your own, and you have to be able to take the medication yourself. There's no assistance. It's not euthanasia. It's a medication the terminally ill person has to take themselves. So it's for someone who's already dying, and they have to wait for a mandatory minimum 20-day waiting period. So this law was passed in 2018 and it went into effect in 2019. So now it's been in effect for almost 2 years. And what we found very quickly was that it was very, very difficult to access the law. So if you lived in Honolulu and were a Kaiser patient, you probably didn't have any problems. But if you live on the Big Island, and we get a lot of calls from people on the Big Island and the neighbor islands, it might as well not be an authorized option. We may as well not have worked for 20 years to pass this law, because a lot of people, especially in rural areas, can't access it. People who are dying, and there's a number of reasons for this. And if there's questions, I can go into it. But after the first year, the Hawaii Department of Health had a summit with all the medical providers who had supported patients in the first year in accessing this option. And actually in the first year, there were 30 prescriptions written by 13 different physicians. 12 of those physicians were on Oahu, only 1 was on a neighbor island. And they all decided that the law needed to be amended right away because it wasn't working as intended. And there was no coercion or abuse, nothing bad happened, nothing that the opposition said would happen. The only thing was that eligible patients weren't able to access the law. So last year, there was a bill proposed by Senator Baker that Senator Rhodes championed, it passed through the Senate. It actually passed through 2 committees actually 3 committees, sorry, on the House side. And I was at the state legislature when the pandemic hit and the bill didn't make it out this session. So we're hoping to have it in the next session. So what the bill would do would be to allow advanced practice registered nurses These are nurse practitioners who have a ton of education, who already have the ability to prescribe controlled substances. It would allow them to be able to support patients in the option of medical aid in dying. It would also allow doctors the ability, or nurse practitioners, if the amendment gets through, the ability to waive that mandatory minimum 20-day waiting period, because we do know from Kaiser and Hawaii Pacific Health that many patients who otherwise are eligible don't survive that 20-day waiting period. So if the patient's unlikely to survive it, they still have to go through all the other steps, but they can still receive the medication and not have to wait through the 20-day waiting period. It would also shorten the waiting period from 20 days to 15 days. So medical aid in dying is authorized in 9 states and DC. Every other state has a 15-day waiting period. So those are the 3 amendments that we're really hoping to make. There's no fiscal note attached to it. It wouldn't touch anything budget-wise, but it would really help sick and dying patients who don't want to suffer in their final weeks and days to be able to have this option. And I just wanted to say thank you quickly for the good, the bad, and the ugly webinar that you did. That was really helpful and really good. And I loved how you talked about John Radcliffe. John Radcliffe was a huge champion for this bill. We're hoping we can name the bill after him. And I'm going to share our website quickly. He's on our homepage, and it's such a beautiful picture of him if you want to click on it. We're compassionandchoices.org. So I think I talked for 6 minutes. I apologize, but are there any questions?
Samantha, what was the Senate bill in 2020? What was the bill number?
SB, wow, I know it, and it just left my mind. SB 2582. And there was an identical House bill so the House bill made it through 3 committees. The Senate bill passed through the Senate, and then the pandemic hit. And I'd also like to give a shout out to Nahaleni Webster. She's one of our consultants who's on the call today as well. We were sitting together in a legislative office when the World Health Organization declared it a global pandemic, and the bill didn't make it through. But hopefully this year we can get it through. There should be a lot of support. The majority of people in Hawaii support the option of medical aid in dying, and it would help eligible patients be able to access the law.
All right, thank you very much, Samantha.
Thank you.
All right, next up is Lourdes Scheibert, Condo 411.
Aloha, my name is Lourdes Scheibert, and I serve as a volunteer director for my association, Condominium Association, and also a volunteer director here at Kokua Council. I'd like to thank my colleagues at Kokua Council who work tirelessly for the kupuna and their families who are in need of help. And thank you, Senator Rose, for listening to our concerns. I appreciate it. And I am an advocate with others in coalition of Hui participants to preserve property rights. I am a retired kupuna living in a condominium, and many owners have experiences with management of a condominium that can be unfair and at times a hardship. Usually these experiences are followed by damage to your unit and your complaints to management. Many kupunas work all their lives to age in place. Many of us cannot afford to live in a retirement home. So let's talk about solutions. So education is a power. For most of us, buying a home is the most expensive item in our lives. And to get you started in understanding condominium self-governance, I suggest free educational programs. But first, get on the mailing list for Atlas Insurance. Email address is infohawaii@atlasinsurance.com. Atlas keeps you informed with condominium insurance policies and HO6 homeowners insurance policies. The Real Estate Commission sponsors a Condorama 4 times a year at the Capitol, and it's open to all owners and to future owners. And they put on an excellent program. ThinkTechHawaii.com, Condo Insider, offer a variety of subjects in condominium self-governance. You can view the videos at any time. So what I'd like to introduce in 2021 legislative action is to change policy. And I advocate to delete 514B 123, assigning proxies to the board as a whole. There are 4 assignment of proxies for an election of board members. One is the owner assigning their proxies to another. Second, for quorum purposes. The third, to directors at a meeting, each given an equal percentage of the votes. The fourth, however, is to assign to the board as a whole to be voted on the basis of preference of the majority of the board members present at that meeting. This proxy was added in 1996 on the Senate House Committee, House Bill 3241. In 1996, the Real Estate Commission also testified with a letter. We question if the amendment will provide more abuse on the use of proxies and whether a new set of problems will appear, such as new type of proxies and or more challenges to proxies. There have been multiple earlier attempts in the last 20 years to remove this option, all with the determination to abolish too much power in the hands of a few for too long. Proxies are necessary for owners who are unable to attend the meetings, and most boards consist of 9 members. If given the assessment of the assignment of proxies to the board as a whole, then the majority of 5 members will be making the decisions for 100, 300, 1,000, or 1,000, or even 1,000 members. Every year, annual owners board meetings are held. Recently, our board of directors sent out notices to the owners to specifically solicit assigning proxies to the board as a whole. The letter went out to say, we promise to represent your best interests. Disturbingly, it explains the proxy designates the board of directors to cast your ballot during the election on any issue, and the emphasis is on any issue that requires a vote. The letter continues, the ballot will be cast based upon how the majority of the board members present decides. By using this option, you have given away your property rights to the majority board members who are minority owners of the community. You have given them broad powers to make changes to the property, the declaration, bylaws, and more, without any opportunity for critical input or your concerns and comments. Proxies assigned to the board as a whole gives a blank check to the majority of the directors based on their preference. Again, abolish assigning proxy as a whole to the board. It serves no purpose other than giving board unlimited powers to volunteer members for their own agendas and the opportunity to keep voting themselves in to office for years. My second initiative is to provide a condominium ombudsman to assist the City and County Department of Planning and Permitting. All condominium owners are mandated to contribute to the Condominium Education Trust Fund biannually, about $10 per unit, $7 to education, and $3 to mediation and arbitration. January 2021, the Real Estate Commission will decide to stop the collection of these fees because of the fund is at about $3 million. I asked the Real Estate Commission to keep the collection of the fees to provide funds for a salaried ombudsman position. Assistance is needed because of the increase and a diversity of owners, and Kupuna's aging in place will expedite the permitting process. And I'd like to speak directly to Senator Rose. When I started going to the Capitol to do this legislative work, I found that the process is totally amazing. And it's governance by the people, for the people, and there are hearings for you to listen to us and for us to contribute our opinions and where the direction of what needs to be called to attention to our community. However, in condominium self-governance, we don't have the same process that that the state legislature going through. So my confusion is, 514B is fashioned to mirror a lot of the process that's going through with the state legislature, but yet the board members who are not educated or don't want to be educated is sourly doesn't use the process of procedure and administrative action to introduce resolutions to inform your owners. Owners all of a sudden go, oh wow, we can have a 100-pound dog. Why is that we're not educating or notifying our members that these changes are happening within our community? Now, there's some condos that are totally excellent in this type of communication, but not mine. I'm sorry, and I'm not the only condo that has a lack of transparency and communication. So I applaud the state Senate that I've gone through the whole process for nearly 5 years, and I find it refreshing if we could take your procedures and your process and your opportunity for hearing to condominium self-governance, because we don't have it. And the start of eliminating some of the hardships we have is to do away, abolish assignment to the board as a whole. That is one of the worst laws that was implicated. And I ask you a question. What would happen if the Senate would have that proxy? I mean, you don't vote by proxy. Not that type of proxy anyway, but but I really appreciate you being here. Thank you.
Thank you, Lourdes. Okay, next is James Gashel from National Federation of the Blind of Hawaii.
Aloha, everyone. Yeah, this is Jim Gashel, and my position is legislative chair of the National Federation of the Blind of Hawaii, and just mahalo to Kokua Council for holding this forum today. It's my first opportunity to speak before you, and I'm really thrilled to have the chance to do it. Just a little bit of background about the National Federation of the Blind of Hawaii. Of is one of the most important words of our name, because all of our leaders and just about all of our members are blind people. And you might just say we're the blind speaking for ourselves. You can join it if you're blind or sighted, but the majority has to be blind people. Now, considering the COVID situation, we're going to have to look at our priorities, certainly, and mindful of the forum that you all put on a couple of weeks ago. And I just want to say that, of course, some of our efforts will be to further the initiatives of the Deaf-Blind Task Force that Senator Rhodes chairs, and we look forward to doing that. But in addition, as for the National Federation of the Blind, our top priority is really to authorize the Public Utilities Commission, as part of its telecommunications authority, to implement a Persons with Disabilities Public Communications and Information Access Service. And this has been done in a number of other states, and we'd like to have Hawaii do the same thing. Now, here's the problem. I'm a blind person, but I'm not the only one. Most of you probably know somebody who is blind, or at least doesn't see very well anymore. Department of Human Services estimates that there are about 12,000 of us here in Hawaii that are blind. But if you add people who can see okay, but they just can't read due to some kind of another disability, it might be a learning disability, etc., information processing disability, you can conservatively come up with a total of about 50,000 people in Hawaii who are in this group that we call persons with print disabilities, blind people included. By far the vast majority of the people in this group are kapunas who have age-related vision loss. You just want to know that the older we get, the harder it is to see enough to read things. Now, lack of access to information is, for members of this group, a common concern. Imagine if you couldn't see enough to read anything in print at all. Whenever the mail comes to my house, I just have to refer to it all as unidentified print objects. Just think about it. It is unidentified print objects. So it's not necessarily funny though, but imagine if you were 65 or 70 and you couldn't read the newspaper anymore. Imagine if you couldn't see the text that crawls across the bottom of the screen when there's an emergency alert going on the television. Imagine not being able to read the list of what's on sale at the grocery store this week. Well, these are just a few examples of common situations that people in our group face every day. At present, the DHS pays for a service called NFB Newsline, and it's a really, really good service, very comprehensive with news information, breaking news sources, emergency alerts, etc. But it's on a year-to-year contract. A shortfall in DHS funding could mean an immediate loss of this vital service. Now, right now, DHS has determined that this is an essential service during the COVID-19 period, and of course, they're right. Authorizing the PUC, as opposed to DHS, to take this program over under its telecommunications authority would solve a long-range funding problem for the state by moving the cost of the service off the state budget at a net plus to the state of about $50,000 year over year. Now, I know this is a small amount to the state, but it is still the right thing to do. It's certainly worth doing. And now, this year, 2021, upcoming, is the time to do it. When that legislation is passed and the legislature, and when the governor signs it, that's what the proposal would accomplish. So mahalo to Kokua Council for considering making this one of your priorities. And I know you're going to have several priorities and some of them will actually cost money. I hope you can squeeze in support for authorizing the PUC to provide a public information program for people with print disabilities. Mahalo.
Thank you, James. That was very informative. I appreciate your presentation. Next in line is Gary Simon for Policy Advisory Board for Elder Affairs, also known as PABIA. And Gary will also present for Hawaii Family Caregivers Coalition. Gary, you're up next, please.
Thank you, Lila. The State of Hawaii Policy Advisory Board for Elder Affairs is the members are nominated by the governor and they're approved by the Senate. And then we all come from varied backgrounds. We have the CEO of Arcadia, myself, we have some professors from UH, so on and so forth. And our charge is to advise the director of the Executive Office on Aging. We're still in, we all experience these social, economic, and political changes day by day. So we're still developing our priority agenda. Jackie had already spoken about the 6 long-term care ombudsman positions. We feel strongly about that, especially now during this pandemic when the residents in nursing facilities and care homes are being isolated. So we're going to help Jackie and John carry the torch and flag on this. And although our agenda is still under development, there are always the big four. Kupuna Care, Kupuna Caregivers, ADRC, and the Healthy Aging Partnership. A lot of you are familiar with Kupuna Care. It's a long-standing social net program to help frail, immobile elders in their home. Kupuna Caregivers is just about the same, but its primary intent was to keep working caregivers in the labor force so that they don't compromise either their wages or their retirement benefits. And the ADRC is the one-stop entry via the web for our citizens to access to get to aging and disability programs. The Healthy Aging Partnership is an evidence-based program, one of the best in the nation, and it helps those make good choices about their diet, improve fitness, exercises, prevent falls, keep people healthy. And it's we call it a budget dust program because all we ask for is $550,000 a year. But unfortunately, when you're asking for budget dust, usually it's the first one to go by the wayside. This is not an all-inclusive list, but it's something, it's a start. For the Hawaii Family Caregiver Coalition, we're members that are passionate about supporting caregivers and their needs and the needs of care recipients. We advocate and promote caregiver programs and policies. One that came to light while was amplified during this pandemic is family visitation. We all know somebody that's been in a nursing facility, in a care home, and has suffered without our visits. On a bigger scale, all of us are prohibited from going into hospitals. Caregivers are part of the linchpin of our healthcare system. So we need to find safe ways of getting caregivers into facilities. Insurance coverage for hearing aids is on our target list, and it's been on our list for a long time. For those who have compromised hearing, over time, and many of us have seen this, they become socially distant. And anytime you become socially distant, everything begins to suffer. Eating, disconnected from your loved ones, so on and so forth. Also, we are going to support John McDermott and Jackie on seeking those 6 long-term care ombudsman positions enhancements. Paid family leave is a tough one this year, but we need to keep it on everyone's radar. And what it actually, more precisely, it's paid family leave for caregivers. And we're actually not looking for full wage replacement, just something to help offset caregivers when they're out caring for their loved ones. And then the big four again, the Kupuna Care, Kupuna Caregivers, ADRC, and the Healthy Aging Partnership. These four have been established over many, many years. So we will continue to support them every year. Any questions? Thank you, Lila.
Thank you, Gary. Okay, next up is Barbara Service. Barbara is going to present for Hawaii Alliance for Retired Americans, HARA, and for the League of Women Voters. Barbara, you're up.
Okay, the HARA is the
Oh,
local
Barbara, your volume. Can you adjust your volume?
I did.
There.
Is that
Okay.
better? Okay.
Yes.
HARA is the local affiliate of the Alliance for Retired Americans. It's a national organization primarily comprised of labor unions, public employee unions, and Kokua Council and the Hawaii Family Caregivers Coalition. Our priorities are basically the four that Gary mentioned: Kapuna Care, Kapuna Caregivers, ADRC, the Aging and Disability Resource Center, and Healthy Aging Partnerships. And we know because of COVID that it's going to be kind of tough to get anything extra. We're hoping to maintain those programs as best we can. But some of our non-appropriation asks are for the bills, as Samantha mentioned, bills that were right in the middle of trucking right along, sort of fell off the wayside because of COVID. One was a consistent age with respect to elder abuse. I think there's a different definitions. Some people consider 60, 62, 65. That was one of the bills before the ledge. Age for serving on juries. We have the highest in the nation. You have to serve on a jury till you're 80, unless you can get off. Notification of cancellation of long-term care policies. A lot of seniors have those policies. They get a notice it's been canceled. They don't see the notice. They don't get another notice, and then their policies are canceled. That was something before the ledge. Also, doctors informing patients of Medicare eligibility. I don't understand why that's a problem, but that was one of the bills. I think that's providing training to first responders about dementia. That might have some cost involved. I guess it would. But these are the things that we want to, that HARA is interested in promoting. Also, Hawaii Saves, which is a way for people to save for their old age. That is definitely a cost item and sort of a problem. Hawaii promised to make higher education available to more people. But basically, like Gary said, the four big Kapuna bills is what HARA is planning to do, and it's pretty consistent with PABIA, with the Policy Agent Advisory Board for Elder Affairs. Same bills every year. We go in to maintain and hopefully get a little more. We know this year that's not going to happen. With respect to League of Women Voters, for those of you who don't know, the League is even older than the 19th Amendment because it anticipated the 19th Amendment passing, which it did on August 18th of 1920. We just had our 100th birthday. The League was 100 years old on Valentine's Day of 2020. It's been in Hawaii since 1946 and very active on Hawaii Island especially, but also Honolulu. Our goals are to increase, maximize citizen participation in your lives and what happens to you. They're very active, especially pre-COVID, very active with voter registration drives, census, providing census information, trying to involve young people. I think right now we have a campaign where we've written to all the high schools to say, please talk to young people about voting. People can register to vote when they're 16. They can't vote till they're 18. That's a bill that might come along. I think it had some traction this year. Also automatic voter registration, another bill that stopped because of COVID and the legislature cutting down, where when you register to, or when you go in to renew your driver's license or apply for a driver's license, you can at the same time register to vote. Now, I just renewed my driver's license or started the process, and that was something I could fill out. But I think it has to do with sharing databases with the Department of Transportation, which maintains the database for driver's licenses, apparently. So anyway, basically, League of Women Voters is to promote citizen participation in our government, and we need all the help we can get. Thank you.
Thank you
Any
very much.
questions?
Yeah, we'll do questions afterwards if you don't mind. Thank
Sorry,
you.
sorry, okay.
All right. Dale Head, Pono Action. Dale, you're up.
Aloha. Thanks for participating today, everyone. Say, I've been in a condo out in Waianae for 36 years. I moved in here at age 35, damn 71, so more than half my life. I spent over a decade on the board in the last 3 years going to the Capitol to try to get some bills passed that would be user-friendly for the condo owners. I've gone down and audited our election materials and found out how our elections are hijacked and stolen by the management company. All right. This excessive fees increase we're subject to every year is a driver undercutting affordable housing in the state. Most people are not aware of this, right? Give you an example. Since 1987, when I moved into my place, inflation is up 128.8%. Back then, people paid $90 for a one bedroom for a monthly fee. Today, well, if it were adjusted for inflation, they'd be paying $205.90. Instead, they're paying $512. And I got two of them combined, so it's over $1,000 a month. All right. Advice: if you want a condo or know somebody does, they're going to go to an annual meeting and think they're going to campaign to be on the board. Before the meeting commences, it's already been hijacked and stolen by the company. This is how they do it. This is how they do it. A third or more of the owners will mark a proxy for the board. This is not announced at the meeting as to how many people did that or how those are going to be funneled to just one or two people, all right? So you think you're running for election to the board, you have no clue whatsoever that they're funneling dozens and hundreds of these proxy votes to people who they want to keep on the board. The reason for this, from the perspective of the property manager, to keep their contract, to keep the board stacked with people they want, they don't have to worry about competition from other companies. It guarantees profits, all right? I use the term Pono action. It's Pono to try to correct the problem, okay? If you go down legislature, well, you're in for a rude education. For instance, we got a bill passed last year through the House on a single day vote to delete that dreadful, deceptive item from the proxy form given to the board as a whole. It passed the House without a single day vote. It passed the House. I testified through 2 committees. It crossed over the Senate. The person in leadership position refused to hold a hearing. All right? Why? Oh, she got donations from those companies. Well, add that up. This is improper. Okay, that's our stand. I'm very disappointed. But to have a committee with the term consumer protection and commerce, usually if the consumer, the business people pay enough money, they win. All right. You as a consumer lose. You get a short end of the stick. So we should have a standalone consumer protection committee so they don't have divided loyalties on what to do. And I've even gone and done email letters and phone calls to the committee members, and they will not address the issue to their own chair. They're afraid of the chair. What nonsense is this? You know? Very frustrated. I'm 71. I don't know how much longer I'll have on this earth, okay? But condos are about half the population now. Urban Honolulu, about 60%. I give great credit to my colleague Lourdes Scheibert for doing good research. Our real estate commission warned the legislature in 1996, don't pass this bill. They did. It was signed into law. What it amounts to is an administrative tool in our condo statute, which is used to steal elections by the companies. They then destroy the records. Okay. And we cannot get redress from the state because the state adamantly, consistently refuses year after year to establish or assign to any executive department oversight. The comment that they are self-governing falls somewhere between an illusion and a delusion. Money talks, okay? But bless everyone for being here today.
Thank you very much.
Feel free to contact me anytime through Kokua Council, all right? Thank you.
Thank you very much, Dale. All right, we have Michelle Cordero Lee from Hawaii Meals on Wheels next.
Hi, good afternoon.
Thank you.
Okay, well, thank you so much, Kokua Council, for being a convener of ideas, for helping us not work in a vacuum and being that bridge between all of the agencies and the individuals. And, you know, I want to thank also AARP, who's done a really great job, who's also been really a convener of services, and just being a really great think tank. Thank you, Senator Rhodes, for joining us today, for taking the time out of your busy schedule to sort of listen to everyone. So I appreciate that. It's been a bit of a crazy year for Hawaii Meals on Wheels. We are one of many direct service organizations out there. And certainly the work that we do isn't representative of everything that everyone else is doing, but just to kind of give you some perspective, when we were hit with the pandemic, we were flooded with a lot of phone calls from Kupuna, from individuals who were sick coming out of the hospital. And basically what we do, if anyone is not familiar, I apologize for not saying this earlier, we serve hot meals to Kupuna as well as those who are disabled. Many of our clients are homebound. Over 60% of our clients receive some sort of medical meal, whether it's chopped, pureed. We are only one of 3 major agencies on the island who have been doing meal service for a long time at the homes. Our niche was very much a hot meal every single day to our clients who are needing a medical meal. Many of our clients, our average age was 86, and we had served on an annual basis about 100,000 meals annually. That means about 8,000 meals a month. And we served about 800 clients annually. But when the pandemic came to us, we of course had to find a way to address all the needs out there. And we had to ramp up quickly. And through the help of the other many agencies, we are serving hot and frozen meals today, not just hot meals, but frozen as well. We had to modify our business model. And we went from, in September of 2019, in 1 month, we served 8,000 meals, but in September of 2020, we served 18,000 meals. So that was an additional 10,000 meals monthly. We had calls from Kupuna who were not traditionally qualifying under the normal Older Americans Act. Now we have Kupuna who are qualifying because they are sheltering in. So we started going into various senior housing projects, especially as adult daycares closed. We started serving clients who were not necessarily of 65, but maybe in their 50s, and they were coming out of the hospital and they had cancer treatment or some kind of medical issue. And then we also were serving a lot more disabled. We had a number of clients who were blind who called us. They were, a number of clients. We just recently signed up someone for service who was blind, who was very used to going to the supermarket, but at this point, he could not tell where the circles are in terms of where to stand. So just very many different issues that a lot of people are going through, and hoping that we can be there to serve them in the best way possible. But in terms of legislative priorities and very much listening to the good, the bad, and the ugly, I really appreciate you know, everything that was brought up by Kokua Council, especially what Kathy Wyatt had said and talking about collaborative relationships, what Barbara Service had mentioned in terms of, you know, Kupuna Care, Kupuna caregivers. I remember Representative Takayama had mentioned possibly combining caregivers and Kupuna Care. I'm not sure what the implications would be. You know, I'd like to hear more about that. You know, as well as, you know, what specifics that would, you know, that would include. So that's, you know, just wanted to give everyone a heads up as to where the agency stood, what we're seeing sort of on the ground. And, you know, I appreciate everything that you guys are doing to be a convener, as well as what so many of the other direct service agencies are doing as well. Thank you.
Thank you very much, Michelle.
This is Carl Rhodes. I'm sorry to interrupt. I have another meeting at 3, so I don't want to like slip out the back door and not answer questions if people want to ask me questions, but I will have to leave at about a few minutes before 3.
All right, well, the good thing is that we have one more presentation, and this would be Ian Ross from Alzheimer's Association, and then we'll go to questions.
Okay.
All right. Thank you. Thank you very much, Senator. So Ian, you're up, please.
Sure thing. Let me get my timer going so I just know how much time I'm taking. Definitely don't want to cut the senator short. Let's see. Thank you very much for this opportunity to present today. I'm presenting on behalf of the Alzheimer's Association on the policies and priorities we would like to see the Kokua Council co-champion with us. I'm the Public Policy and Advocacy Manager for the association's Hawaii chapter. I want to start out by just talking a bit about Alzheimer's disease and why it's important that we do more to tackle this crisis, because it is in fact a public health crisis. Today, it's the 6th leading cause of death in the United States and the only cause of death among the top without a way to prevent it, cure it, or even slow its progress. Right now, it directly affects 29,000 individuals over the age of 65 in Hawaii, and 1 in 3 seniors passes away with Alzheimer's or another dementia. Alzheimer's disease has a profound effect on the 65,000 family members who provide 74 million hours of unpaid care for their loved ones in Hawaii. Family caregivers also suffer their own health crises as a direct result of the stress related to providing Alzheimer's care. If you compare demographics of those who are caregivers for people with Alzheimer's versus people who aren't caregivers, there is a pretty dramatic increase in personal health care costs for those individual caregivers for their own health care. Also, the New England Journal of Medicine reports that Alzheimer's disease, it says now, but was the most expensive disease in the United States, surpassing both cancer and heart disease. Of course, now COVID has immeasurable costs. So let's say the 2nd most costly disease in America. But costs are also expected to skyrocket. They affect Medicare, Medicaid individuals, and caregivers. So the good news, in 2014, a state plan was developed and released by the Department of Health, The plan had recommendations from a task force of more than 40 community and government stakeholders. The recommendations broadly were prevention and treatment by 2025, care quality, expand support training, respite legal, financial, and safety, increase awareness, and data collection and monitoring progress. The unfortunate fact is limited progress towards this plan has been made, and many legislators and government agencies and departments often don't know what's in the plan. The Executive Office on Aging is an important exception here. They're fantastic on this. Senator Rhodes and I have had a chance to discuss the state plan before, along with some of my advocates who met with him and his staff. So he's a notable exception too. But broadly speaking, this is a hurdle that getting this information out there is really crucial. So we need an Alzheimer's coordinator position. I'm going to talk a bit about that in a little bit. But also we can't wait for the coordinator position. What I tell at every one of our state advocacy days is that the time to act is now. On the state advocacy history, the Alzheimer's Association Hawaii has long played a role in state advocacy. And since 2013, we've been active in the development of the Hawaii 2025 State Plan on Alzheimer's disease and related dementias. That's the Department of Health plan I mentioned earlier. And we also have held annual advocacy day events. And I'm happy to share that we will be doing a great advocacy day, mostly digitally next year, come what may. So a little bit about the history. We've been fighting for the state coordinator position since 2014. We did actually pass a funding bill, Act 127, but a small typo in the bill withheld funding from going forward, which has been very frustrating. We've also fought for pilot programs to expand dementia screening for Native Hawaiians. And we had an ambitious Alzheimer's legislative agenda last year. So I see about 1 minute left on the clock, so I'm gonna go to our asks. The first is we are asking for appropriating funding for the Alzheimer's and related dementias coordinator position. I have fantastic news for those of you who have been following this journey. The BOLD Act, a bill championed by the Alzheimer's Association nationally, brought about $20 million for the CDC for grants to make centers of excellence and to give funding out. Hawaii is one of 15 states that have qualified, and we actually have funding federally for this bill through the end of calendar year 2021 for the coordinator. So this is fantastic news, meaning next year we would really love your support to fund half of fiscal year 2022 and all of fiscal year 2023. So it's a year and a half, and it's really important we don't drop it once it gets started, because that would really diminish progress. The second is something we've already heard today, so let me add my voice to it. We want to see the appropriate funding for the Kapuna Caregivers Program. Feel free to jump in. I don't think I heard a number recommended earlier for funding amount. So we're also flexible on this, but I'm leaning towards a very conservative defensive posture on this because of the state of the budget, which would be asking for 1.5 million, which will be in line with the 2 years ago funding. Last year, no funding bill passed, but a combination of CARES funding along with a leftover fiscal year budget meant that the program is still running. But we really do need to get the funding out. Previously, we pushed for increases in funding. I'm not sure if that's going to be the most feasible. But those are essentially our asks. I have one more ask if I can squeeze it in. It's if you have your phone with you, if you ever want to hear updates about bills that we're doing and get calls to action, you can text IMUA, I-M-U-A, to 52886, 52886, and you'll get notifications infrequently when you can contribute on an individual level as well. Thank you very much for this opportunity to present. Mahalo.
Thank you very much, Ian.
I have a short question before Senator Rhodes leaves. And that is that the session coming up, we will probably still be in pandemic distancing requirements. I'm just want to put in a request to see some wholehearted effort toward the ability of people to participate at a distance in the same way that we're convening this sort of thing at a distance now. And that would include giving testimony perhaps by this method also. And that's all I wanted to say.
All right. Thank you, Doug.
The senator is trying to respond. I just noticed he's on mute.
Sorry. You're talking to the right guy. I'm chair of the Judiciary Committee, and we have already had a special session to confirm judges a few weeks ago, and we're about to have another one. And we've sort of been the guinea pigs for accepting a testimony by Zoom. I think it's by Zoom that we've been using. Anyway, like we're doing now. So I expect that will continue on into the next session. It'll probably continue even after COVID is gone.
Great news. Thanks much.
Senator, since we're running short on time, would you like to do a wrap up? And then we'll continue with our program.
Well, I would just answer questions. I don't need to wrap up anything. Thank you for letting me sit in, and I've heard a lot of, I've heard all the presentations, and we'll certainly keep it in mind. But yeah, I can answer a question or two if people want to.
All right, anyone want to volunteer a question? Well, I think if you were having appropriations, there'd be more questions for you. Senator Rhodes, thank you so
Thank
much.
you very much. Take care.
We appreciate
Thank you,
it.
Senator.
Take care.
Aloha.
We'll let you know the results. Thank you very much, Senator. Everyone else, please remain. What we're going to do is we listen to 12 presentations, and we would like to learn what your priorities are. If you will list your 5 top priorities. For many of the presenters, of course, what they talked about would maybe make up their 5 top priorities. But nevertheless, if you could list your 5 top priorities and send it to kokuacouncil.programs@gmail.com, then we'll compile them and send you the results tomorrow. Okay, any questions about that? All right. Well, thank you very much, everyone, for participating in today's, well, not today's, Kokua Council's annual community forum. We may be doing another forum similar to this. What happened is when I reached out to many of our past participants, they were not ready. And a lot of them referred to COVID as interfering with what they were working on this year. So I will be corresponding with all of you via email tomorrow as to the results of our legislative priorities. And we look forward to your participation in future Kokua Council meetings.
And I wanna point out that it's live on Facebook and it goes play on demand in a couple of minutes. And we'll also hike it up to our YouTube page, and I'll circulate that in case you missed a particular presentation, or that if you have a friend that wants to see it.
Excellent. Thank you very much, Doug. To all of our participants, mahalo. Thank you very much for participating. I learned a lot, and I hope you continue to join us and present your ideas. We hope to see you at the legislature advocating, well, maybe not see you at the legislature.
Lila?
Yes.
This is Jackie, and I know you're really busy, but since I'm driving, I couldn't write down the address for my choices. Could somebody email me that address, please?
Yes, Jackie. I'll send it to you. Thank you.
I'm so sorry. I know you're busy.
Oh no. All right. I can send it to you. Thank you very much.
Thank you, ma'am.
So mahalo to everyone. Really, really sincerely appreciate your participation. Please stay safe, take care, and we'll be in touch. Thank you.
Aloha.
Aloha.
Thank you, Lila. Mahalo.
Thank you. Thank all of you.